Okay, first of all, very good afternoon to you. Before we start with anything, I would like to know your name as well as how many years since you've been practicing.
I'm Dr. Sanjay Shinde. I'm a practicing urologist at Indore, and I started my practice in 1990. So this is almost 23 years, I've been practicing, and this is all I can say about me.
So 33 years, obviously, experience plays a major role. So we're going to have the topic of prostate cancer. So first question over to you. What are the early signs of prostate cancer?
See, the prostate cancer is an entity, but the symptoms are very much similar to the benign prostate symptoms. So the benign prostate symptoms are actually the urinary related symptoms where the person has to go to toilet many times, or he has the urgency or cannot hold the urine for a very long time, or the urine stream slows down, or he has to strain or push the urine out. So these are the usual symptoms. And when we talk of prostate cancer, the symptoms are also almost the same. In addition to it, suppose if the prostate has become very advanced, then you may have the constitutional symptoms like loss of weight, loss of appetite, or maybe the bone pain also, because when the prostate cancer goes into the bones, then the bone pain can start. Many times prostate cancer is diagnosed when the person has a fall or something and he breaks his bone, and that is the time when we come to know that the bone fracture is not a normal fracture, but it is the pathological fracture. That means there is a malignancy in the bone, and because of a trivial fall the fracture has occurred. So this is how we know the prostate cancer can be diagnosed. So there are varieties of presentation of prostate cancer, but in general, when you say that a prostate cancer has started giving symptoms, these are usually those symptoms which are actually the symptoms of benign prostate.
Heading towards the next one. What precautions should a man take to minimize the risk of prostate cancer?
Okay. So all the usual, low risk factors or, avoiding the risk factors for prostate cancer are the same which apply for all other cancers, like healthy lifestyle, active lifestyle, and pollution-free atmosphere, adulteration-free food. See, these are all the possibilities by which, you can reduce the incidence of prostate cancer.
Okay. So next question. Who in today's date is at highest risk for prostate cancer?
Okay. See, the prostate cancer is more common in white race or even in the Western countries. And only one thing which you can attribute in the diet is the non-veg food, particularly the red meat food. Because the red meat is the one, which is more consumed in the Western countries, particularly in the white race. And that is the reason the incidence of prostate cancer is little higher compared to people in India and other tropical countries. So this is one way you can attribute that probably, red meat, high red meat consumption is one of the factors which has a higher incidence of prostate cancer compared to vegetarians like Indians.
Okay, heading towards the last one. Any message that you have for all the upcoming urologists?
Regarding prostate cancer?
Yes, anything.
Acha, okay. For upcoming urologists, you see, they have a huge possibilities, of the development in the technology part in urology, and this has given us, an impetus, in the growth of urology in last 1 or 2 decades, and this is going to bounce, further. So the young urologists which are coming now in the practice or in this fraternity, they will definitely see lot of technological advancement and paradigm shift, in all kinds of management of urological diseases.
Okay, well, thank you very much. That's all. It was nice talking to you. Have a great time ahead.